Tampa Bay Community Cancer Network, also known as TBCCN, is a group of organizations that have come together to create partnerships for better health. Through outreach, research, and training, TBCCN is working hard to reduce gaps in cancer care. Let's take a look at what TBCCN is doing in your community. TBCCN is providing high-quality education and improving access to useful and easy-to-understand cancer information in many languages.
TBCCN embodies the spirit of partnership. The simple answer is the health disparities that we face in a community like ours are too big for any one of us to tackle alone.
My idea of TBCCN is a whole community of educators and thought leaders and scientists and researchers that are trying to get the word out on health disparities.
We found that we have had better access to educational materials, that they've brought in many different languages and ways in which to approach our patients.
So TBCCN serves a variety of diverse populations, foreign-born populations, underinsured, uninsured, low income. So it pretty much runs the gamut, but individuals who, for a variety of different reasons, may not have access to cancer-related information or resources.
I always tell my students, knowledge equals power. So now we empower them. They have the power to know where to go or where to use these resources. And TBCCN is one of the best.
Researchers are joining with community members to develop and evaluate innovative programs to improve community health and bring advances in cancer research right to the community.
Part of what has come out from the research that I've been doing in collaboration with TBCCN is one of the issues is health literacy. And what we've been able to hammer out over years is an educational program, particularly for our women who don't have a good understanding of their own bodies when it comes to, well, women's exams. So this is a low literacy, high image type of educational tool.
Well, of course, in my community, initially, research was kind of a mystical word that people really didn't understand. And I think part of what TBCCN has done is come in and made it something that people could relate to and show them that this is not a scary thing, that it's really going to help them. I think when they talk to our clients in our community centers, they found out, research is your friend.
So the research that we do in TBCCN is really comes from ideas that come from our community partners. Over the years, we have talked about the health disparities we face in cancer screening and early detection. One particular area of importance is the colorectal cancer screening, where we have very well-established tests that we know work and can benefit our communities.
TBCCN scientists and community members are training aspiring researchers on how to best tackle health disparities at the local level in ways that fit the everyday lives of people.
I think that culture is a very important factor to know that when I'm going into the community, I have to understand the community that I'm in and to understand how to approach them, maybe how they speak, what they believe, or how they act, and not come in different, but come in as this is my community as well, and I'm here to help us.
Most of my research and my work in the community is working with Latino cancer survivors. I currently have several projects that really came from my relationship with TBCCN and the needs that Latinos in the community identified related to education, to support, and to programs that are really meaningful to them and that are in Spanish and easy to understand.
We have to get together. We have to share our knowledge, our wisdom, our cultural competencies so that we can reach as many people as possible and really not worry about who gets credit, but worry about the outcome for our community.
Today, TBCCN is helping in the fight against cancer for everyone's tomorrow.